Good day, viewers. My name is Timlay Okea, and I'm the editor-in-chief of Surgical Interest Group Lagos, SURGIL. And today we'll be interviewing Dr. Michael Sanusi, a cardiothoracic and vascular surgeon here in Nigeria. He is the medical director of the Babcock Tri-State Health Heart and Vascular Center. He's an adult and pediatric cardiothoracic surgeon and a fellow of the American College of Surgeons as well as the West African College of Surgeons. He obtained his medical degree in 1990 at the University of Ibadan here in Nigeria, and he's currently practicing here in Nigeria. He did his residency at the UCLA Drew University in general surgery and later did a fellowship in cardiothoracic and vascular surgery. And today he has performed over 1,000 successful surgeries here in Nigeria and abroad, over 600 open heart surgeries, and he has positive clinical outcomes at the peak of medical care across the world. Join me and my colleague Victoria Mokwenge as we interview Dr. Michael Sanusi. So thank you, sir, for being with us today. So we'd just like if you could walk us through your journey into surgery. How did you become this renowned surgeon that you are today?
Well, I don't know about renowned, but I can tell you how I became a surgeon. I always wanted to be one. I think since I was a medical student, I thought it would be great to be a surgeon, but I wasn't sure how how possible it was going to be. My favorite rotations as a medical student were my surgery rotations in Ibadan, surgery 1, surgery 2, surgery 3. That's how we had it in UI. After, I decided to do my postgraduate surgery residency outside of Nigeria because I thought that's probably where I would thrive the most. Because I thought, you have to be extremely smart and very competitive to do postgraduate in Nigeria because Nigerians are very smart. So I took the easy way out. I did the exams, and fortunately, I moved to the United States. I applied for residencies. I got residencies in other things apart from surgery. Everybody said it's very difficult to get residency in surgery. But I was kind of persistent. That's all I wanted to do. So fortunately, there was a fellowship. They used to have clinical fellowships then in the US that were not accredited or not residencies. So really like MO jobs. So fortunately, somebody was leaving that job and introduced me to them. So I worked with a group of orthopedic surgeons for a year. There were 8 orthopedic surgeons. And so at the end of the year, or at least halfway through the year, I applied for residencies, same residencies that I applied for before. I didn't get interviews, but because I now I'd worked in the United States, I did the in-service exam. And I was fortunate to do well. They allowed me in that hospital because they had a surgery residency program to do that in-service exam. And fortunately, I did well. I did better than their residents. Those guys wrote very good letters for me. So I was fortunate. I sent out. Then you didn't have to pay for applications. So I remember I sent out 80 applications for surgery. And I got 5 interviews. Yeah, I attended my 5 interviews. And my very last interview was in a hospital in Los Angeles. And there they were just so friendly and very nice. They had an African that was a year ahead of me. He was Ghanaian, and they were quite impressed with him. He went to medical school in Chicago, but they were quite impressed with him. And so they were willing to take on other Africans. So I matched categorical straight there. I was very excited, and that's where my journey began.
Thank you very much, sir. So I would like to ask, what would you say is the difference between your practice in Nigeria and practice in the US?
Well, I'll say um, the difference is volume, organization, technology, obviously. you know, practicing in Nigeria is not all strictly medical practice. There's life to practice in Nigeria. What I mean by that is sometimes you have to take care of some other things. You have to have like in the US, you can actually just go to work and ignore everybody, ignore everything. There's already a system. You can go to work, do surgery, go to your office, see patients and everything, and you just automatically submit bills or whatever, online, and you don't have to really interact too much. You can just walk, and keep your head down. In Nigeria, there has to be a social face. Um, the patients will have your phone number. In Nigeria, they will ask you questions. They'll call you. They wake you up early in the morning. They will, there's like an interaction that is not like that in the Western world, and then you want to do surgery. You have to be friendly with the hospital matron, with the, with the, you need to have blood for your patients. You have to visit the blood bank and talk to them, make sure everything is in order. And then before you do surgery in Nigeria, you have to make sure that everything you need for that procedure is available. You can't assume that everything, otherwise you get into the operating room and there'll be trouble because you might have opened up the patient and you find out that you don't have a certain kind of suture you need or a certain instruments that you need, which is taken for granted at the other parts of the world. And those are just examples.
So did you know you would always come back to Nigeria, or you know, if yes, what inspired that coming back? If no, what changed along the way?
Well, so since the day I left, I knew I was going to come back, and I felt that's what God wanted me to do. So since the day I left Nigeria, when I got to the US, I stayed. My uncle is a surgeon in the US. He paid for all my exams and everything. I said, "Uncle, I'm going back when I'm done." Even before I got a residency, when I'm done, I'm going back. Of course, he laughed and said, "Just wait till you finish. You're not going to." And but when I finished, they say your words make a way for you. When I finished, I found myself back in Nigeria.
So, sir, during your medical school in Nigeria, so how equipped did you feel like your undergraduate training? How equipped did it make you for your surgical residency training program? Do you feel like it helped you?
Oh, I think it did absolutely. I think we had and we have very strong medical schools in Nigeria. I never cease to be amazed when I interact with with you guys, medical students, and with the amount of knowledge and the amount of you know professionalism I see in young people, medical students. I can't say for everybody, but I worked with medical students in LASUF, at Babcock. Come across some of you both medical students, and so I think there's actually a lot that we learn, in medical school as example, and then you sit down and you read the books as well, and you learn a lot. There are some things that you mean. So we learn a lot of theory, much more than the medical students outside the country. But the advantage they have is they have a lot of they see a lot more. So if you combine that theory and stuff that you learned and you read in the books and the exams you had to prepare for, you now go to an environment that is more relaxed but has a lot more to offer, more volume of patients, more surgeries being done, more equipment. It's a win-win situation. In full scope of things, where would you see, considering your practice, considering the knowledge of training you have, where would you see Nigeria ranks in the world in terms of 21st century surgical care? Well, that's a very interesting question. I finished my cardiac surgery residency probably almost 20 years ago. Kind of like a bit behind. Since then, there's a lot that has happened. There's a lot of the 21st century surgical care is focused on minimally invasive things. Almost everything they try and think minimally invasive as much as possible. If possible, they don't want to even cut you. So at least in cardiac surgery, they're using the robots for a lot of procedures, mitral valve procedures, even coronary bypass. They use robots for in now if you want to do a lobectomy, the lumpectomy, remove part of the lung. In most Western countries in the world, it's unheard of to make an open incision, except you really have to. They'll do it with the video assisted thoracoscopic surgery, and so things are really. They harvest veins for coronary bypass. They use a scope, and so those things are very different from what we have here, because a lot of times we cannot afford the technology. But at the end of the day, one good thing is that we've actually made some good progress here. At least we can treat the different types of diseases. We may not be able to treat it the modern way with robots and scopes and all that, but the cardiac surgeons have improved in Nigeria. The neurosurgeons have improved greatly in Nigeria in getting things done, procedures done, and getting them done safely. Urologists, the general surgeons, different aspects of surgery. When they find plastic surgeons that are doing free tissue flaps, stuff that was unheard of 20 years ago. Yes, the Western world has really left us far behind as far as minimally invasive and stuff. But the thing is that here, at least we're getting things done. Our patients have hope. Like 20, 30 years ago, everything was very crude and then refined. For example, you couldn't get a hip replacement or a knee replacement in Nigeria, obviously 20, 30 years ago. But today, people don't have to travel abroad to get their hip replaced or their knee replaced.
Thank you, sir. So earlier you talked about some differences when it comes to healthcare infrastructures in the US as compared to Nigeria. I would like for you to talk about health policies. What do you think the difference is in terms of health policies in the US and in Nigeria, and how is that really affecting care profession?
Okay, so I'll try my best to answer your question with the ones I can remember. I think the two main things, and truly what really affects health is policy. That's really the bottom line, is what is the policy of a country towards health, how seriously they take it. In the United States, the GDP is health contributes, I can't remember, but at least I think 15 to 17%. Some people will tell you as much as 25% of the GDP. So that means essentially health is looked at as healthcare is looked at as a revenue generator. Is not, while in Nigeria and a lot of African countries, the mistake is that they look at it as charity. They miss the economic part of it, in that it can create jobs. It can create prosperity within a society. Apart from taking care of human beings, people are serious business. So you need to, so there's no investment, because it's not looked at as an investment. It's looked at as a, gift to the poor and things like that. And then if you really want to invest your money, you go and build a refinery or etc, etc. So that's one big difference. So, and then the big elephant in the room, so to speak, is healthcare insurance. So any country that has good healthcare insurance has a healthy, a healthier population. And that means that, a lot of people put money in a pot, and then a few people, when they need to take out of that pot, they will, and then they can get the best care possible while they are out of that pot. Not everybody's going to be sick at the same time, but those people that are sick, they can now afford to be taken care of. And then the standard of living of the healthcare worker is also better. So he doesn't have to be looking for opportunities outside the country, and it doesn't have to be lured, and then the skills of the healthcare worker are improved because more people have come to seek help. They're not afraid to go to the hospital, because when there's no money in healthcare, people are afraid. Oh, I don't know what those private hospitals, they will just, kill me. Even when you go to the government hospitals, things are getting more expensive. So people don't. So the people don't get the care they need. The healthcare workers don't get the training that they need. The main difference between the Western world and us here, apart from there's technology, but volume. Volume is a big difference. So, especially in surgery, the more you do, the better you are, the safer you are, and that the better for the patient. The more the surgeon does, the better for the next patient. Your experience always stays with you, and the next patient gets better care. And
Thank you very much, sir. You spoke about investment. You spoke about how health insurance plays a big role. But we want to ask for the viewers, which are mostly medical students, how can we as aspiring surgeons, how can people who are already surgeons play a role in closing that gap?
well, one thing you're doing is, like, for example, you guys have formed a group that and when a group of people come together, they have a voice, and people listen to voices. Maybe some health policy makers may listen to you in future as you get bigger and and stronger. But we just learned our time. We learned medicine, medicine, medicine. There's nothing wrong with that. But you have to learn medicine with business a bit. Or if there were classes, you can learn the business of healthcare. You might be you might be able to make a difference, you might be able to make people understand and be more effective. So you find that a lot of hospitals, when I was growing up, you find hospitals will be flourishing, then after 5 years, the place will just crumble. I think that is beginning to change now. There are real investments being made. And then I think another thing is group practice. So, and referring to learning that culture of referring. Nobody knows everything. Referring to people that know more than you in a certain aspect. You may be a general surgeon, so you may not need to be doing craniotomies, for example, in your private hospital. And the other important thing is everybody should specialize. That's my own personal opinion. Everybody should specialize in something. That's how it is in the Western world. You don't find MOs just dotting the place. I told you my first job was almost like an MO job. Within a year or two, they canceled those kind of jobs in the whole United States. So you finish your medical school. Your next year is your house job internship. In some countries, you do a rotating internship. In many countries, you go straight to, if you want to do surgery, you start your internship in surgery and you go. So that by the time you are done, you are very good at what you do. And the other person is also very good at what they do. So there's little chance of, there's less chance, not little chance, of patients being mismanaged.
So, sir, you talked about like infrastructures, and I think when we think about infrastructure, there's a material part, but there's also a human resource part. So this is an elephant in the room, really. Japa. For the viewers that don't know, so Japa means always leaving your country to another country. I'm seeking greener pastures, really. So, what do you think? Because I honestly believe that correct me if I'm wrong, I believe Jaguar is something that's inevitable. Like people will want to leave, so you cannot say they should not go. So how do you think that we can reduce the frequency at which people leave and get them to stay? Because we need doctors in Nigeria.
Well, so you're very right. The Japa syndrome is very real. A lot of doctors have left. And I think one of the reasons that people leave is so they can get fulfilled. It's not just really only about economics. It's also about fulfilling your potential, So people leave so they can better themselves. Sometimes, you want to learn more, you want to learn better, say, and have more, be able to practice your trade more. So obviously, the way to help with that is to try and make the infrastructure here better. But like, when you started, you talked about infrastructure is not only buildings and materials, and there's also the human. I can't hit the nail more on the head than that. So I look around Nigeria, I see everybody's building hospitals. The government builds hospitals, but they have not, they're not building people. The hospital is just a building, except you have people that are trained to medical personnel in that building. So I personally advocate that money should be spent on training. They say, oh, if you send them abroad, they won't come back. Well, that might not be the case, and maybe some people won't come back. But I can tell you that right now, a lot of people in the Western world wish they had have worked there and are very good at what they do and are very experienced, wish they had a chance to come back to Nigeria and give of themselves, or even live in Nigeria, retire, or whatever in Nigeria. But they don't have that opportunity because everything works together. The economy, the security, and all that. So if all those are well attended to, you find that it's out and in, and it's people that go out that can bring things in. There's so many countries. You can, of course, the story of India. India has very awesome medical system, but it's the jackpot people that brought it back, that made it happen. It's people that left, and then because the government had favorable policies, a lot of them came back to the country, and their medical system is very awesome. So yes, people, it should really be make a good environment. Some people will leave, some will come back, but knowledge will keep flowing.
So in the next 10 years, where do you see the surgical care in Nigeria?
The surgical care in Nigeria in the next 10 years, I'm optimistic that it will keep getting better. I'm a bit concerned that there's a very about the Japa right now, because it's all people going out and very few people coming. So I think in the next year or two, it may be very rough, because more and more people have no choice and are leaving for many reasons. But in spite of that, the specialties, the skills in surgery are really increasing in different surgical aspects. There's a lot of collaboration with Nigerians and doctors in diaspora. Every time they're coming in and doing missions, bringing technology to the hospitals, they can't sit still where they are. They come, they do surgeries, they go back. Right now I'm working with a vascular surgeon that comes every 2 months to Nigeria to do excellent, great work at the same level as been done where he works in the United States, So I think all those will start to take us to the next level in medical care. It takes a lot of money to get to the level of where things are really catching up with the technology, the minimally invasive and things like that. But trust me, the fact that they're doing it doesn't necessarily mean it's better. Some of it is a lot of economic driven and all that. Sometimes some of the old ways are not so bad, and as long as they can take care of the patient adequately. So in the next 10 years, to answer your question, there will be improvement in medical care in Nigeria. I think by then we'll have good insurance, and
Thank you very much, sir. Um, Bringing things to a more personal side, especially concerning you, we just want to know what has been the most rewarding aspect of your career in surgery.
I think the most rewarding aspect of my career and any surgeon's career is your patient doing well, really. So you find that when you go out at the beginning of the day and you took care of patients and they do very well, you come back home not tired, even if you're busy all day. If you um, go out and maybe something went wrong, might not be your fault, you come back and you didn't do that's what you did for the day, come back a bit tired. So that reward is what is so I think seeing patients do well, getting sometimes I get pictures of children, maybe a year, two, maybe their fifth birthday, and they maybe operated on them, maybe 4 years ago or something. That's very rewarding. Yeah.
Thank you, sir.
Thank you, sir. So I'm really excited about this question. So majority of our members, myself inclusive, are interested in cardiac surgery. There's a cliche that people say that surgery is a calling and you must have some specific traits to be a surgeon. I want to know what's your opinion on that. And also, what would you tell someone that wants to be a cardiothoracic surgeon who's interested in that?
And that's a good thing, is that these days there's more exposure, so you have to count your costs. And that's I'm not saying that lightly or in a discouraging way, but you just have to know what it involves. So you probably, if you could take a rotation, spend some time, so whether this lifestyle is for you, where you're busy, you could get called at any time. You have spent hours in the operating room. So, it's not like the glory that you see on TV. There's a lot of things that go with it. So, sometimes you may not get to see your family as often as you want. So once you know that, it's better to know that before you get into it, and then you now know that, okay, I love this thing. I really want to do, like, I couldn't convince me to do anything else. Even now, if I had to go all over again, that's what I would want to do. But there's some things that I didn't know when I was jumping in, and it's nice to at least have an idea of what some of those things are before you, and then experience other parts of medicine, and then you can really decide what is for you. So specific traits are being committed, dedicated, hardworking, being I don't use the word obsessive or compulsive, but surgeons tend to do the same thing the same way over and over. So that way, because the way they are comfortable doing it. So to be a cardiothoracic surgeon is not, you really don't want to do too much experimenting. You want to find a safe way to do things and try and do it. And it's not that you are not innovative, but you're careful, so because you know that people can get hurt if things are not done right. I think the traits are, really wanting to do it, to really enjoy what you do, to be committed to your patients, to um, be able to to take care of maybe your family side and your work side at the same time without getting too distracted by any of them. Those are things that help you to be successful. And come to think of it, in most things that you do is still the same. That's all around. So thank you very much for having us. We're really grateful for this opportunity.
Yeah, thank you. I'm actually really, but I was just nodding. I'm very honored to be here. Thank you.
Okay, thank you for interviewing me.